Integrative oncology is an evolving specialty for patient-centered care that uses complementary therapies parallelly to medical treatment, and that is why it is important for us to have it. It enhances the efficacy of medical treatment, it improves the symptom control, and alleviates patient distress, mental or physical. And it looks at complementing the medical part of therapy to treat the mind, body, and soul as a holistic approach rather than just the patient or the disease itself. It includes a variety of therapies such as nutritional, mind body movements, meditation, exercise, fitness regimens, and also aesthetics. This improves the patient's capability of withstanding the therapy well, it avoids treatment delays and faster recovery and adds value to the cancer treatment of the patient. Integrative oncology is more focused at holistic healing rather than being only disease oriented. And I must confess that we as oncologists look more at the patient, the disease, and the tumor. We do not really look at all the aspects of patient treatment when we are looking at the patient. We all know, however, the importance of integration of curricular and extracurricular activities in schools, and that is what makes up for a complete education of a child and all-round development. The same way, incorporating these complementary therapies into the patient management helps the patient, who's the reason for our presence here. Integrative oncology actually includes partnership of patients and healers. By healers, I mean us doctors, dietitians, nutritionists, fitness trainers, pain specialists, counseling services, and it treats the whole person, assists the innate healing properties of each person. We all have innate healing properties, which we do not realize. It promotes health and wellness as a seamless continuum. Patient is diagnosed with cancer, we have to make them ready for treatment, both physically and mentally, to have an optimal outcome. And once the treatment is over, also we should stress on the rehabilitation and wellness. So it's both a synergistic approach towards patient management. Patients often feel that the problems they perceive as important, they fail to receive sufficient attention from the doctor, the treating doctor, such as me probably. They are very much worried about the nausea, pains, feeling of reaching nowhere, depression, lack of confidence, looks, and also are confused about the food intake. When all such programs are integrated into the supportive management, it improves the patient's quality of life, satisfaction, and they feel more in control of themselves rather than being at mercy of medications and popping up medicine for each symptom. More importantly, it bridges the gap between the doctor, disease, and patient management to improve the patient's quality of life. When the patient sits in front of us, our focus of attention is the tumor rather than the environment in which the tumor is growing. So this such integrative oncology program would provide the missing link. And certainly such programs will not only improve patients' quality of life, but also assist the doctor in treating patient as a whole. I must compliment Samara, who has taken this bold step of bringing this specialty to India. Congratulations, Samara.